are suffering as a result of breast cancer. Others survive the pain. Meanwhile, other women lost their lives in the wake of fighting this deadly cancer. You and I have the chance to protect what we have. So you are welcome to the PB Show Moments of Truth October Cancer episode. Remember to subscribe to the PB Show if you're new on this channel. We'll be right back after this short break. Don't go away.
You are welcome once again to the PB Show.
Thank you very much.
Yes, so it's the moments of truth right here. We are just going to say it just as it is. So first of all, when we talk about breast cancer, I mean, we've been hearing breast cancer every now and then. When October comes, we are always hearing breast cancer awareness. What is breast cancer all about?
Okay, so breast cancer is the disease of the breast, okay, in which the cells in the breast goes out of proportion or they goes abnormally. So that's all that we need to know about breast cancer. The definition for breast cancer, disease of the breast. The breast is actually it's a tissue on its own. So any part that begins, so we have the breast as a tissue is made up of the ducts, the lobules, and a whole lot of things that makes up the breast. The nipple is even parts of the breast. So the breast is a tissue, but depending on where the cancer occurs, then we can say that place has become what's cancerous. So breast cancer is a disease in which the breast cells, goes out of proportion or goes out of control. That's all I can say about breast cancer.
Oh, okay, but what actually causes this? What causes this?
Yeah.
We're talking about when it grows out of proportion. What actually causes that?
Okay, so in general, cancer, any type of cancer as it stands now, the other time when you came around, we were talking about childhood cancer, we realized that the main cause is unknown. So it also applies to breast cancer. Actually, the main cause for breast cancer is unknown, but there are other risk factors, okay, or predisposing factors that can make one prone towards having cancer. So some of these risk factors can be controlled by the individual, and there are others that cannot be controlled by the individual. So some of the risk factors that can be controlled by the individual is one, smoking. If you are smoking and you realize that, the rate at which you're smoking is not healthy, like it's not good for you, you are in control to either stop it or continue with it. So smoking is one risk factor that every individual, every female, okay, would have to put an end to. And I'm using the word female because men also do get cancer, but when you pick about 100 men, you only get like 1 or 2 men having breast cancer. Okay, so like I'm saying, some of the risk factors that one have control over is smoking. And the second risk factor is drinking of alcohol or excessive intake of alcohol. Then the third risk factor that we have is hygiene, personal hygiene. Now, we have some women who are obese by nature or by their own personal life or living, they end up becoming what's obese. Now, this person is going to take a bath. Okay, so when you realize that you're obese, when you're going to take a bath, you just need to lift your breast up. Make sure you wash underneath your breast very well. Taking care of your brazier, your personal hygiene. Okay, that is another risk that we have control over. Then another risk factor that we have control over is obesity. So you have control over how you want to maintain yourself, okay, when it comes to whether you are fat or whether you are slim. So you need to make sure that when your BMI is being calculated, that is, BMI has to do with your weight and height. We use the weight and height to calculate BMI. So you need to make sure that when this is being calculated, you fall below 30. So when you're above 30, then it's a cause for alarm for diseases like breast cancer, you being predisposed to diseases like breast cancer and other diseases like hypertension and others. Now, the risk factors that we do not have control over, which are very key points, is one, female. It's unfortunate that you being born as a female didn't put you at risk of having breast cancer. Okay, so every female is at risk. I am at risk. You're at risk. Every female listening is also at risk of having breast cancer. Then the other point is hereditary. Okay, so when you actually sit down, you assess your family, you realize, okay, there has been an auntie in your family who has died of breast cancer. Your great grandmother died of breast cancer. Your grandmother also died of breast cancer. Even your mother also died of breast cancer. Like the issues of people dying of breast cancer is high in your family. Then you actually need to sit down, think through it, walk into any facility as often as you can in a year, and to have your breast being examined by professionals. And the other one is also genetics. Okay. Genetics in the sense that we are all made up of genes. Okay, we are all made up of genes, and when it comes to the genes, there are very two important genes that we have. We call it BRCA1 and BRCA2. Okay, so this BRCA1 and BRCA2, they are genes that are in the breast, okay, that help in the breast. Okay, now what happens is that when these genes are mutated or when they are damaged, okay, then it makes an individual prone towards having breast cancer. Okay, so this BRCA1, BRCA2 are actually good genes. In actual sense, they are immunosuppressed. They are suppressed tumor genes. But in cases where an individual's genes, this particular genes, are not able to function well, or they're being mutated, or they are being destroyed, or they are being damaged, then it makes the individual prone towards having breast cancer. So basically, the causes of the main cause of breast cancer is unknown, but the risk factors that I have made mention on earlier on, the ones that we have control over and the ones that we do not have control over, are the things that we actually consider when people walk into our facility.
Yeah. Thank you. What determines that I really have a breast cancer? I think you mentioned it earlier.
Okay, so first and foremost, we all need to know who we are, our body makeup. So you need to know the size. In actual sense, one breast is bigger than the other. Okay, that is nature. But in getting to know this, you should also have in mind how your breasts look like, the size of your breasts. You should know, okay, one breast is bigger than the other, but I actually know that, okay, if I put two of my fingers together to hold my breast, it covers it. Okay, like something to determine how big or what the size of your breast is. So that when your breast is becoming big or it is growing in size, or there's any change on your breasts, okay, on the skin, then you can detect it early. Okay, so like I'm saying, or like I said, one breast is actually bigger than the other in every human. So some of the signs and symptoms that we can actually look out for is when there's a change of the skin, okay, of the breast. When there's a change of the skin of the breast, sometimes it comes with the skin being inflamed. It looks reddish. Sometimes it comes with a lump. You can feel a lump, okay, in your breast. That is if you are someone who is able to, examine your own, do self-examination. You realize that upon examining yourself, you can feel something which is about 2 centimeters wide in your breast. That looks like a lump, okay, in your breast. You have your nipple inverted, okay? So your nipple, instead of it coming out, it is actually going inward. And you have sore nipple, the skin of the breast is actually darkened. And you have discharges Okay, so this discharge is the ones that you actually look out for or should actually give us a sign that, I mean, this could be dangerous. One is bloody discharge from the from the breast, and the other one is also brownish discharge from the breast. So any discharge you have coming out from the breast, unless you are breastfeeding, of course, if a mother is breastfeeding, the discharge or the thing that comes out, that's the breast milk, you can see it clearly. But if you're not breastfeeding, you're not on, I mean, nothing is happening to you and you begin to have discharges coming out from your breast, then you actually need to go to the hospital for proper diagnosis to be done, then the rest of the treatment to go on. Yes.
Okay. All right, thank you very much. But assuming after all these things that I know about, now it happens that, God forbid, but it happens I'm living with cancer. In case it happens this way, what is the next step? What should I do when I realize that there are some changes in my breast? What's the next step?
Okay, so when you realize that you have certain changes in your breast, then the most appropriate thing to do is to walk to any health facility for you to be examined, for diagnostic tests to be carried, on you, so that the right treatment to be given, because breast cancer has so many treatments that comes with it. There are people that they combine chemotherapy and radiations. There are people that they combine chemotherapy, radiations, and surgery. There are some instances that people will just go for chemotherapy to shrink the tumor. When the tumor is being shrinked, then they would do a surgery. Then another chemo is also given so that there will be no reoccurrence. So when you come to the hospital facility, you realize that you have certain changes on your breast, just walk to the nearest healthcare facility so that the right people who are knowledgeable will take care of you. I know of someone who I came into contact with somewhere last year, had cancer and was told that by the doctor that they would have to take out the ovaries and the fallopian tube. And the patient didn't go back. Meanwhile, she was diagnosed with breast cancer in 2019, May. She didn't go back. And before she could say jack, the cancer had spread. She came back, and in 2 weeks' time, she just had to die. So depending on the type of or how fast your cancer cells are growing, then the proper treatment to be given to. So we have hormonal therapy, we have chemotherapy treatments, we have surgical treatments, we have radiotherapy treatments, we have so many treatments for cancer. So it's just about making sure that these cancer cells are being detected early, so that you would not be part of those who would have to have their breast, the entire breast, being taken out. So in that case, when the entire breast is not taken out, we call it conservational therapy. Okay, so we conserve. We are not taking the entire thing. We are conserving some part of it. Okay, so that is what actually happens. So when you realize that you have changes on your breast, just walk to the nearest healthcare facility so that you'll be attended to, so that the worst does not happen.
All right. But then after the removal, assuming you have the cancer and they remove the, how do you call that one? Is it the lymph?
Yes,
okay, so after the removal, are we safe? Can you say that, okay, now I am fully okay? Or there is a probability that maybe the second breast may develop another? Is there a probability?
So like I'm saying, okay, one thing about cancer treatment is when the patient is done, they are asked to come for reviews. Okay, so some of the reviews are in months. Subsequently, when they realize that, okay, upon the labs that you continue to do and bring to the hospital, things are getting better, then your doctor may expand it to 2 months, 3 months, sometimes yearly. So yes, there are chances where people tumor has been removed, but it's reoccur. Okay, so it's all about coming for review, so that there are patients who come their surgery is being done, they're asked to come for review. Even the first review, they end up missing the first appointment review. So you just need to make sure that you are into contact, you are communicating with your doctor. When you're asked to come for review, you do come for the review. So that when there is anything happening again, then the doctors can detect it early, because with cancer treatments, the main word or the key word is detection, early detection. So when it is detected early, then yes, you're safe. But yes, there are reoccurrences. There are instances where there are people who have had surgery, the tumor has been removed, but it reoccurs again. Yes. So it is possible. Reoccurrence of cancer cells or tumors are really, really possible.
All right. Thank you so much. But before we leave, anything you want to add up before your final words?
Okay, so what I would just want to add up is that we should, as like I'm saying, like I've been saying from the beginning, it is not just women who have breast cancer. We have men who also have breast cancer. So if out of, when you pick 100 men, you would find 1 or 2 people who would have breast cancer. Okay, so as women, since it is more related to women, we should just make sure that once or twice a year we walk to the health facility. Now we have October to be a month for breast cancer. So you can just use that opportunity to walk into any health facility. It is free of charge. But it's unfortunate that we have people who would actually walk into a facility and they can't imagine themselves lying down. They are asked to take off their braces, and someone will just touch their breast. Okay, so if you are that person, you realize that you are uncomfortable with it, and you can let your spouse do it, your husband do it, then and it's fine for your husband to do it. If you can do it yourself, you know the procedures, that the ways by which one can do self-breast examination.
Even if you could help us now, but probably later in the interview, you will teach us how we can examine our breasts. Is that possible?
Oh, it's simple. You know, examination of breast is simple. What matters is the hygiene, and because if you don't keep all these things intact, you don't have a personal hygiene. There are some women who wear their braces for a long time without washing it.
Especially the black ones.
It smells. Yes, because they realize that it is, yes, especially the black ones, because they realize the color does not change. They will wait and wait and wait and wait, and I mean, it is something else. So we should have personal hygiene. Wash your breast, lift your breast, wash it very well. I mean, if you want to do self-examination, you can just put your hand. So depending on where you really want to examine, if it is your left breast, you put your left hand behind your occiput, your head. Okay, then you just start from the outer part of your breast. Okay, so somewhere around your armpits, coming inward to the nipple. So you start from the outer part, then bring it to the tip of your nipple. Then if you want to do same to the right breast, you put your right hand behind your head, then you also start from the outer part. Because there are some tumors that can come, they start from under the armpit. So you need to make sure that you get, to the very outer part of your breast, if possible, closer to where the armpits are, because there are some tumors that can actually develop over there, but you might not notice because you think they only happens in the breast. So you start from the outer part, you'll be doing it in a circular motion to the tip of your breast. So that is how it is actually done. So whilst you're doing it and you are done, you are done with the circular motion. And whilst you're doing, you need to make sure you are pressing it to the chest. Because if you only do it like it's nothing, but you need to make sure you are pressing it to the chest to make sure that you are not feeling any lump in your breast. Then when you are done, you also, try to pull or pinch. I don't know the word to use. Try to pull your nipple to see if there's any discharge. Okay. So to make sure that you don't have any discharge coming out from your breast, you also try to press on your nipple a little bit. Then you make sure that you are fine. So we should just make sure that we take opportunities of the month of October to examine, to walk into any health facility, have our breast examined. If we cannot do that, then we can also let someone who is good at doing that, or probably yourself, do that. And another thing I would also want to add to it is that we should rather exercise faith when we have certain disease condition. Yes, because sometimes when you have faith, it speeds up your diagnosis, it speeds up your treatment. And so depending on the religion in which you find yourself, faith is good. It's good to exercise faith, but we shouldn't relate things to it being spiritual, live it like that, and we don't do anything about it. Childhood cancer, when I came on your platform to say that it's not on health insurance, I think with breast cancer treatment, some of them are on insurance. Okay. So we should take the opportunity. If you realize you are being told of having breast cancer, don't go back home and sit in your house. Depending on the treatment being given to you, like I said about my friend who was told that her fallopian tube needs to be removed. Her ovaries need. She was just worried about
from the breast to that place.
Yes, it means it has spread. No, it wasn't that it has spread to the fallopian tube. Okay. But the ovaries, and the fallopian tube, okay, helps in the release of hormones, the progesterone and the estrogen. Okay, so when a woman wants to give birth, it is the progesterone that comes into play. Now, when it has to do with our reproduction system, okay, anything relating to menses and others, our reproduction system and maintaining it, the formation of breast and stuff, it has to do with the hormone called estrogen. Now, when you have your fallopian tube and your ovaries intact, so depending on the treatment, because the doctor, it's not all breast cancers that people walk into the facility and they are told that your fallopian tube or your ovaries needs to be removed. But in some cases, the cancer cells become sensitive to these hormones that I'm talking about. So that is when they end up doing the hormonal therapy. It's either they are giving medications to stop the release of this hormone called estrogen and progesterone, okay, or the woman's fallopian, they give medications to also make sure that the ovary is also not releasing progesterone. Or in some cases, when they realize that, okay, the rate at which this cancer cells is reacting to the individual's hormone, which is the estrogen and the progesterone, would have to do a surgery to remove the things that produces this hormone. So it doesn't mean that when you have breast cancer, I'm not here to put fear into anybody. Yeah. But like I'm saying, early detection is the best. You might just walk into the hospital and they will just do the lumpectomy, just remove the tumor, and the breast will be there. I mean, though it becomes small, we have prosthesis, okay, where you can even put it there. Nobody will even know you have even gone to have any surgery. So if it is detected early, you might not have yourself worrying about all of these things, having your fallopian tubes removed. But at some point, even though it is detected early, some people, cancer cells react to these hormones and it makes them grow faster. So when they realize that, okay, these hormones are making the cells grow faster, okay, then let's give medication to help stop these hormones, okay? And that is what happens. And in some cases, like I'm saying, but it doesn't mean that the cancer cells have spread to the fallopian tube or the ovary. They're just removing it because it is releasing those hormones that is making the cancer cells grow faster. Okay. So please, like I'm saying, it is on insurance. So make sure that when you're being diagnosed of breast cancer, you just get into any health facility. Most of the treatment is on insurance. Unlike children, they don't even have money. It is not on insurance, but you and I, that we have money, it is on insurance. So just walk into any health facility, have your breast examined, and make sure you take opportunity of this money. Thank you very much.
Thank you so much. It's an honor to have you on this show. All right, so dear audience, thank you so much for joining us on this week's episode of the PB Show. We were privileged to be with Mrs. Carlos Tego, Mercy Carlos Tego, and she had it with us on breast cancer, and also she works with Korle-bu Teaching Hospital. Thank you so much for joining us. Until we come back, you're wasting time next week. Ladies, make sure you do your regular checkups. It's the month of October, and if you visit most hospitals, they are checking it for free. So take advantage of this opportunity and go and examine your breast. Thank you so much.